Hi, I'm Jen, and we're from Therapy Playground. Today I'm a parent, and this is Jenny. She's the occupational therapist. And we're here to talk about a common concern among little boys and little girls of a certain age, broken bones due to high activity levels. David broke his arm last week, and because he fell off a swing, and he's a regular patient here of Jenny's. He gets occupational therapy, and I have some concerns about his arm, and that's what we're going to talk about today. Jenny, what should parents be concerned about when a child breaks an arm? What are some things, some red flags once the cast is on that we need to be aware of?
Okay, so once a child has a cast in place, you need to make sure that you check his fingers or his arm above or below the cast for swelling. So my first thought with Davey was to look at his fingers and make sure there's not excessive swelling, changes in color or temperature in the fingers, and if there are, some of the things that you can do are massages to help some of the swelling go down, exercises with our finger to make sure that we're keeping all the movement in them, as well as pumping some of that fluid out.
Very good. I know, we had concerns earlier. What exactly would you do in therapy? Because his arm is broken and there's so much activity that usually goes on in therapy. What do you recommend that parents bring their child for therapy with the cast on?
I do. It depends on what the child's goals are. With Davey, we do a whole lot of activities based around movement and touch and textures. So with Davey, we'll just have to modify the treatment, and so I recommend that the parent discuss it with the therapist, because usually there are other things that we can do in therapy. We just have to modify it, because we're not going to want to do some of the activities that would put Davey at risk for re-injuring that arm. But at the same time, there are a lot of other things that we can do with him.
And what would some of those activities that are specific to Davey that you can do in therapy even though his arm is broken?
Okay, so one of the things that we do with Davey is I do the brushing and joint compressions, and so that doesn't change except for the fact that I will not be brushing the left arm or the right arm. Okay, put it down.
Put it back, baby.
And the other things that we do, a whole lot of texture play. We can do some of the things, like on the scooter board and things like that. I can continue doing some of the movement processing activities, and then we can do some more of the motor planning activities. We would just probably slow it down a lot. For other children, we may be doing fine motor tasks. If it's not their dominant hand, we can continue doing those things with the unaffected arm. With Davey, because it is his right hand, we will not be doing fine motor tasks with the right hand. But that's okay, because that's not really a goal with Davey.
Davey, would you like for us to film some of your therapy so that the world can see what it is you do with Miss Jenny, even though you have a broken arm?
Yeah. And this is just a technique that we use to help be able to process movement a little better. It's called the Astronaut training program. Some children have over-responsiveness to movement, and some children have under-responsiveness to movement. And sometimes Davey has a little over-responsiveness, which means he gets dizzy really quickly. And how does that affect his daily life? It means that he's going to be a lot more active. He's going to seek out things a lot more. And so you can see, Davey is getting dizzy.
Clockwise rotation in sitting.
Are we ready? We're doing the opposite, aren't we? Where do we hold our head? Of course, this is a little bit modified from the true protocol. Just
saccadic eye movement.
Now Davey is going to be challenged to look at movements. Again, it's called rapid horizontal saccadic eye movements. And this is also helping his vestibular system.
Slower horizontal saccadic eye movements.
Good. Is this hard?
Rapid horizontal smooth pursuit eye movements.
So these are rapid horizontal smooth pursuit eye movements. So that means Davey has to track from right to left or left to right without moving his head. And he's also having to process the sounds through his ear. So again, this is just another technique we use to help with processing the sensation of movement. Good job, baby. Let me high five. Yes, and with that. So again, that was called the Astronaut Training Program, and we use that to help with processing of movement. Again, vestibular system, if it's not functioning properly, it affects a child's ability to focus or sit still in a chair. They may always be seeking it out, or they may not want to move or climb up onto unlevel surfaces at all. So thank you for stopping by. We appreciate you. Appreciate you watching us. Thanks. Say bye, Davey.